Welcome everybody, welcome back business leaders and past participants and attendees of our webinars. We want to welcome you to another installment of the Workforce Resilience webinar series. This is a monthly series produced by Utah Community Builders, which is the Salt Lake Chamber's Social Impact Foundation. At these webinars, you're going to hear from experts that will give you actionable information to help you enhance the mental fitness of your employees and make all of Utah's workforce much more resilient. So before we get into today's topic, I want to briefly give special recognition and warm thanks to those who have generously sponsored this important webinar series. Our major leadership sponsor is the George S. and Dolores Dore Eccles Foundation. Our champion sponsor is AT&T. Advocate level sponsors are Larry H. Miller Group of Companies and FJ Management. And ally sponsors are Blomquist Hale, Intermountain Healthcare, and the Utah Department of Human Services. Now, today we're discussing cultivating employee team well-being. And for that, I'm very pleased to welcome Morissa, Henn, and Matt Steinkamp, two experts and people with Intermountain who are going to help us talk through these issues today and give you, like we said, some actionable information. So with that, I'll turn it over to Morissa and Matt. Take it away.
Great. Thank you so much, Nick, and just thanks to the Chamber for this incredible series that has turned out to be such an important space for dialogue and really action-oriented planning, I think, in this challenging year. Thanks for bringing up the slides when you have a second and helping us advance those, Nick. Today, I'm really honored to be here with my colleague, Matt Steinkamp. Matt is the Director of Intermountain's EAP program, which, as I'm sure he'll describe, serves much more than just the Intermountain community, but also many other employers. Are you guys getting an echo, or is that just me? Let's see. Nick, maybe if you go on mute, that might. Let's see if that helps. Okay, I think we figured it out. Great. So, as I said, Intermountain EAP serves numerous organizations across the state, and I'll let Matt speak to some of the specifics around ways that we can help support our workforce in these challenging times and in all times. My role is as our community health director at Intermountain, responsible for community mental well-being initiatives. And such an honor to work with people like Matt every day as we look to uphold and improve the resiliency of our internal workforce, but also of the community as a whole. So we can go on to the next slide. So if you were with us last week, I actually had the honor to join a session about education. And I promise not all the slides will be repeats if you were there, but for me, this quote from one of the leaders in global mental health, Dr. Vikram Patel, I think really captures so much of what is part of the challenge and part of the reality we're all grappling with right now, especially in a year of pandemic, of wildfires, earthquakes, social unrest, dialogue around racial equity, et cetera. And what Dr. Patel says is that our minds rely on certainty and predictability of future events to be able to plan how to spend one's time. That is exactly what has been turned upside down. And uncertainty and lack of control are drivers of stress. We know this stress can lead to increased anxiety and depression, especially among people who are already vulnerable for a variety of reasons. But I think I'd like to open us today by arguing that all of us as professionals, as leaders, as members of the business community have been affected by this uncertainty and stress, whether that's affecting parenting and work from home, issues of how to process election information, how to put food on the table, but really want to acknowledge these kind of common cause elements of uncertainty and unpredictability that are part of our reality now and are part of the challenge that we need to help our workforce grapple with into the future. We can head to the next slide. So as someone who has a public health background, I like to frame kind of the broad forest, and then Matt's going to help us get into those individual trees. The mental health effects of COVID-19, along with some of the other challenges I've mentioned, are quite profound. As of a few weeks ago, the US Census does a, I think twice monthly, what they call pulse survey. And here in Utah, 43% of adults are reporting symptoms of anxiety or depression during the past 7 days when that question was asked in January. And that's an increase. That's an increase from what we would expect. We don't have exactly comparative data, but we know based on other prevalence information that that is certainly higher than it was a year ago at this time, and has been on the rise, particularly during the surges in COVID transmission. Nationally, over half of people report worse mental health at work since the start of COVID-19. And I think that really is one of the reasons we're here, is to think through what that role is, what that impact is with the workplace. And none of this is terribly surprising to us. We know from past disasters, whether it's wars, terror events, natural disasters, or disease outbreaks, that there are both short and long-term destabilizing effects of these large-scale events. I think what makes COVID-19 in particular very challenging is that the very things we are doing to help contain the physical threat of the virus, things like physical distancing from other loved ones, at times needing to shut down or reduce access to businesses and schools, these public health measures can sometimes also contribute to some of the stress and some of the isolation that we're struggling with. Another thing we know from past disasters when we look at data and evidence is that oftentimes the mental health consequences are a bit lagging, meaning they come later and they last longer than the physical threat of, say, a pandemic. So unfortunately, the challenges of this past year probably aren't going anywhere so quickly. And in fact, it would not be surprising to us to see some lingering effects of stress and trauma that continue to peak even after the disease itself has peaked. Another thing I just want to mention before we get into some of the dynamics happening again at this more macro level is that not all populations are affected equally. And we'll look at a little bit of data in a second showing that younger people and also people from communities of color seem to be disproportionately impacted by the stresses and the psychological challenges of this time. We can go on to the next slide. So to build on that point, this is a study this summer that the CDC did looking at the prevalence of adverse mental health outcomes related to COVID-19. And what you can see, the left side is showing prevalence of anxiety or depressive disorder. The right side is exploring suicidal ideation. And what's notable here is, for people who have lower levels of education, for groups in some cases that are non-white, and for younger people ages 18 to 24 who are part of our workforce, we're seeing some much higher impacts of adverse mental health issues burdening these groups. So, I think the good news is we have not nationally or locally seen an increase in suicide rates. So people are not dying at a higher rate by suicide, and we can talk more about that if there's interest. But people are struggling. This has been a hard time, and it's a hard time for those groups that I just mentioned in particular. We can go on to the next slide. Also, as a little bit of a preview of some of what Matt is going to talk about in the workforce, I thought this study from the National Institute for Healthcare Management really stood out, discussing whether employees feel they have anyone they can turn to for emotional support at work. And as you can see, it varies a bit depending on the position of the employee, but among supervisors, only about 1 in 5 feel that they can confide in a colleague about mental health issues. Among people who feel that they just among coworkers and peers, it's a little bit higher. And for people who are maybe a little bit younger or lower on the hierarchy, definitely fewer feeling that they have somewhere they can turn. And for those who have no colleagues, who may be working alone, maybe a bit higher because they're reliant on social networks and social connections as part of their day-to-day, as opposed to relying on it in the workplace. So definitely a sense that there's some high need here. And I also think this comes at a time where, thanks to the chamber and other groups locally, there really is growing recognition that employee mental health influences and is influenced by the places where we work. And that this isn't just really the right thing to pay attention to in terms of mental well-being, but it's a major determinant of performance and productivity.
Sorry, my phone audio dropped. Can you hear me through the computer audio?
Yes.
Okay, great. We'll go on to the next slide. And I just want to also acknowledge, this is coming, these challenges are coming on top of an already challenging time. Stepping back to that period pre-COVID, mental health and substance use were already major challenges for our state and our community, with about 1 in 4 Utah adults experiencing poor mental health, about 1 in 4 of us actually living with someone with a mental health issue. And the Mountain West region as a whole has higher rates of what we call deaths of despair, deaths by suicide, opioid, and other forms of substance misuse, as well as alcohol. So we're coming from a challenging spot, but looking to really make progress during a difficult time. Go on to the next one. And the question many of us are asking is, okay, so where's this all going? We know it was a challenging time prior to the disaster when it came to mental health. And now we've been, given some additional challenges surrounding the issues I've discussed. So this is kind of an interesting graph that you may have seen in some prior webinars, that the Substance Abuse and Mental Health Authority, the federal agency focused on mental health, provided based on prior major crisis events. And you'll see there's often this kind of shifting trajectory of how our populations and communities are doing. And I think the challenges, and so there can actually be emotional benefits to going through something difficult together. And you see that kind of in that early heroic stage. But then there can often be this very long, what we call disillusionment phase, where folks have been working from home for a long time, or out of work, or feeling just a sense of insecurity as their kids' schooling remains uncertain and their vaccination timing is unknown. And that's where many people worry we are right now. We, of course, don't know because we're moving through this day by day, but the question of, when will we move into kind of the reconstruction phase remains a bit of an unknown. This is a kind of unique disaster in that it's not a single event. It's sort of a cycle of different hardships that we're all navigating together. So go on to the next slide. So now that I've depressed you by how difficult this pandemic is and this past year has been, I do want to give some reasons for hope, because I really feel extremely optimistic in this time, and also, of course, want to make sure we talk about what the actual tools are that we have at a community level, and Matt will talk about some of the tools and strategies at a workplace level. One of the things we've been really lucky about here in Utah have been the rapid expansions in the availability of telebehavioral health to reach people in new ways. Probably what would have taken 3 to 6 months, or 3 to 6 years rather, to roll out normally happened in about 3 to 6 months of just huge uptick in various health systems reaching people in the comfort of their homes through telehealth platforms, combined with many of the regulations and reimbursement barriers being lifted. So Intermountain was among those who really leapt at the opportunity to expand our telepsychiatry practice. And so we launched Connect Care Behavioral Health over the summer, early fall, and it's been extraordinary. So many of the people we've reached would not have sought care otherwise, either because of geographic barriers or because of stigma. And I just love this quote from one of our nurse practitioners who's providing care, who said, we're doing important work. I've never worked at a place where I felt over and over, if we didn't help people, they wouldn't be getting that help. So just a testament to one of the many examples of expansion in reaching people through digitally enabled tools. Go on to the next one. Another service that Matt and I have been deeply involved in has been standing up the Emotional Health Relief Hotline, which is a free call-in service we hope that you and your teams will share. And we have trained caregivers to do rapid assessment and triage of callers at all levels of distress acuity, and help connect them with resources. Sometimes it might be an acute resource, like an actual crisis that needs to be responded to. In other cases, it may be that they need some help connecting with free mindfulness classes or getting on an app to help improve their sleep. So this has been a really exciting endeavor in collaboration with many community partners that has served close to 6,000 people since we launched last year. Go on to the next one. Another exciting area of work that Intermountain's been excited to work with many state partners on has been the launch of the Live On campaign. And you may have seen some of the billboards and radio ads and social media that have been launched over the past several months. But this is Utah's first ever attempt at going beyond individual marketing of, say, a service to saying, how do we change all of our social norms around key protective behaviors? And what I mean by that is, how do we encourage people to seek help for themselves or others when they are struggling with a mental health or substance use issue? How do we give them the sense that this does not imply that they're a weak or somebody who's lacking in character, but actually is doing something out of a place of great strength in helping and seeking help? And then how do we create a safe environment, which I'll talk a little bit more in a second. So the Live On campaign is really exciting. It's a public-private partnership where the private sector raised over $1 million, including not just traditional entities like Intermountain and U Health, but also the Church of Jesus Christ of Latter-day Saints was one of the main funders of this effort. And then working to build on the best possible evidence to get the word out there. And all that funding was matched by the Utah legislature. So very excited about Live On, and hope you will visit liveonutah.org. There's a ton of resources there, as well as training opportunities for you and your teams to take advantage of. We'll go on to the next one. A topic I always want to touch on in these sessions has been the work we have been engaged with our gun community in. And I want to say that again, that as a health system, we intentionally partner with gun groups, gun retailers, gun advocates, because we know that access to firearms is a major driver of Utah's high suicide rate. And our gun advocacy community really has been critical in saying, we bring different worldviews to this issue, but we have to work together to keep people safe and alive. And that's because guns are the most common and most lethal method of suicide. So if we can put time and distance between someone who is going through a difficult time and a gun through non-legislative, non-regulatory approaches, much like a friend taking the keys of another friend who's been drinking, we can often save a life. And so I include here a quote from Utah's main gun lobbyist, Clark Aposhian, saying, "For too long, the issue of suicide by firearm has been awkward and uncomfortable. Through collaborative efforts, that's finally changing. Conversations about gun storage and suicide risk can protect those we love while respecting our Second Amendment rights." And we've been doing a ton of work on this, whether it's distributing close to 40,000 gun locks last year and for free through many community and health organizations, whether it's through that safe environment aspect of the Live On campaign I mentioned a few minutes ago. We've also been involved in some collaborative legislation oriented toward ensuring quality training and opportunities, again, to frame this not as a pro-gun or gun control issue, but instead as really an issue of loved ones helping one another through a difficult time. So grateful for the work of diverse partners on this. And it's been especially important during COVID when gun sales have been much higher than usual. And we've come together to do some Facebook Lives and other social media, recognizing this common ground approach. Go on to the next slide. The last resource I want to mention before handing it over to Matt to talk more about specific strategies and tools you can deploy in your workforce. One of the amazing resources we have here in Utah is at UHealth, and it's at the College of Nursing. There is a leader there, Kathy Supiano, who is essentially one of the nation and world's experts in complex grief. And she and her team sponsor 2 truly extraordinary and free support groups that they've been offering throughout this year, and they repeat on a regular basis. The first is a COVID-19 grief support group for people who have lost a family member or friend by COVID, and their grief process has been very disrupted for obvious reasons of it being very difficult to be together, to often be with the person in their final days and moments, and then to grieve through traditional methods like funerals and memorials. So want to really give a huge shout out to that COVID-19 grief support group. Another group that's been very powerful and also free is the COVID-19 recovery support group. And this is for people who have been dealing with the emotional and physical aftermath of surviving a COVID-19 infection. As you're probably aware, it can be a very traumatic event, and also many people have myriad symptoms that last for a very long time. And so just really want to help publicize these support groups. And there's also other support groups that the College of Nursing offers, including some specifically focused on those who have lost a loved one by suicide. They're just one of the best, and I fear not well enough known resources here in our own state. And just want to give a huge shout out to Kathy Supiano and the Caring Connections program. So I'm going to stop there. I hope that this has helped provide some big picture perspective into what's happening at a state and national perspective when we think about the impacts of this challenging year on mental health, and also hopefully given you a little hope and resources based here in our own community as we navigate whatever comes next. And so I'll hand it over to Matt now to zero us in on the workplace.
Thank you, Morissa. And thank you for that excellent overview of what's going on in the broader community and nationally and more on a macro level. Nick, if you want to go ahead and click the next slide. I want to shift to talking about what you all can do. One, in terms of taking care of yourself, because that will be important as business leaders that you're modeling good self-care. We want to talk about how some warning signs of those you're working with. And again, how as a leader you can support them. But I want to start with, I think during this unprecedented time, I came across, early on in the pandemic, I came across this model, and I really like it. And I'm not able to find the source, but this came out, I think I saw it originally in March or April. And I think the question is a good one. Who do I want to be during COVID-19? And if we look back over the past 10 months, really kind of taking inventory, we probably all have dabbled in one of the three circles there that are listed. The author talks about, a fear zone, that I come from a place where I am, maybe even paralyzed from what's going on. Again, this is an unprecedented pandemic. We haven't dealt with it before. I get stuck in a place of fear and anxiety, and I'm not very effective in my work, in my family. And that, again, not everybody started there, but we probably all dabbled in some piece of that because of the newness. I hope and I think as this has gone on, and I challenge you all to kind of take inventory of yourself, because operating from a place of learning or a place of growth is certainly going to be a more constructive and probably better place to come. But as you look at those statements in the various shades of the blue boxes, which ones resonate for you? Versus spreading fear, I pay attention to my emotions. I don't complain frequently. I keep those things to myself. I try to be constructive. I try to be empathetic with others. I operate from a place of appreciation. If we can start there, obviously, I think it's obvious that we're gonna deal with the issues that are presented and be in a better place to address not only our concerns, but the concerns of those people that we're working with and around. And as leaders, I think that's important. So I think my message here is, at least many of us have a choice on how we show up. And I think that can be and needs to be somewhat of an intentional process for us, starting with when we get out of bed and start heading into work, and what kind of leader do I want to be today? So I just throw this out as something for you to think about. That as leaders, I think it is important that we are intentional in the work we do. We're intentional in how we support those folks that we work with. And again, we're intentional about how we show up. So I just share that as a starting place. Nick, if you want to go ahead and move forward. So Morissa's talked about, not only is it COVID stressors recently, but we've had a number of stressors impacting us, be it social unrest, politics, and obviously the pandemic. But I want to talk a little bit about these. And again, these have ebbed and flowed a bit as this has gone on. But at least up until the vaccine time, it feels like that lack of control of circumstances has been a very big one. I think the vaccines provided a little bit of relief, even though I know not everyone has had it. There is some hope there that's being presented, but this pandemic has hit us in a way that, one, we don't know what to expect. Unfortunately, we got very mixed messages within the community and nationally. Maybe not so much in the community, but certainly nationally we did. And again, we don't. When Morissa spoke to the importance of stability and being able to predict things, and we just haven't been able to do that. So, as we look at this list, many of these will be not necessarily be new, but they'll be heightened based on the pandemic. The media can be a particular stressor, and those of us that seek it out regularly, and I'm guilty of that over the past 10 months. I've certainly spent more time in front of CNN than I have in the past, and that hasn't always been positive. And I've got a supportive spouse that says, "Why don't you turn that off? It's probably a good idea. You've probably gotten your fill of negativity today," and I've appreciated those things. But just know that media, that constant media, can be aware, and it can affect us kind of in the background, if you will. It makes us less tolerant of stressors, day-to-day stressors, if we have that one running in the background all the time. I think of it as kind of a ticker tape running in the back of my mind, and I need to be conscious about turning it off. The ambiguity, what's coming next? When or will this end? Those questions are coming up. And again, we're getting, hopefully, clearer messages about that. I think they're realistic messages, or they're being real. The message is coming out now based on science and those types of things. So that's a good thing, I think, generally for people, if there's consistency in those messages. And then how will it impact me? Everything from, will I keep my job? Will I be hired back if I've been let go? How will this impact the work we're doing? Many of us have been required to work from home at Intermountain. If that's an option, we've been directed to work from home, and probably we will do so till June. That's been a real struggle for me, and it's been a struggle for other folks that I know. I don't feel like I'm as productive. I'm hearing that from others that that they feel they're more productive, and kudos to them. It's not how I would choose to work. We've heard from people that separating work has been hard. How do I shut down and unplug at 5 o'clock or 4 o'clock? How do I not get up at 5 and start working when I would typically drive into the office at 8? We may not have the space. We're dealing with our kids who are being homeschooled. And we're now isolated from our colleagues who, hopefully, in most cases, we appreciate and enjoy working around. So those are all things that need to be, again, kind of added to our, our bucket, if you will, of stressors that 10, 12 months ago, we weren't having to deal with at the level that we're having to deal with now. The heightened fear, again, can I get the vaccine? Will it work? Can I trust it? Should I get it? Am I at risk? Are people taking precautions? I've heard many sad stories around people being somewhat, again, paralyzed by fear. And I get it. I understand it. And I'm not here to judge. But it's not a great place to be. It's not a great place to wake up in the morning and start from. And I think the biggest one the biggest change that I've heard that has impacted folks in ways that I hadn't considered was how we've had to deal with grief and loss. And it's been generally a very isolated, non-participatory, event. We're hearing of people losing family members and saying goodbye to them by iPhone and iPad. In the medical community, what we're hearing at Intermountain is how difficult this new grieving process, to not be able to share it with the family members of folks who are in the ICU and who are likely going to pass. And again, to have to communicate by text and iPhone and iPad. Thank goodness we have those things, but it's not how we ever intended to, spend those last moments with people, if that's the case. So if you've got folks who have experienced loss related to COVID, just recognize that that's been difficult. I mean, loss in itself is difficult, but this new way of, without choice, for the most part, having to deal with grief and loss has been something I certainly hadn't considered until, early summer when we started hearing these stories. We sent a group of folks out to New York to support their work groups out there, and everybody came back having experienced that very traumatic time, saying this was the hardest piece of that. So I better move along. I'm telling too many stories and we're going to run out of time. So let's keep going, Nick. So signs of stress, I don't think there's anything particularly profound here. Difficulty concentrating. Generally, people have trouble with sleep. Eating and appetite might change. You're going to feel a lack of energy or perhaps exhausted. Again, we're using energy managing this COVID stress, and we may or may not even be aware of it. But it's taking resources from us personally, emotionally, psychologically, spiritually, physically. Decrease in enjoyment, lack of engagement. We might be shorter with the fuse, higher irritation. We're seeking information incessantly, and it's not, again, positive. And then we're going to see physical symptoms and responses, stomach aches, headaches, tightness of muscles, those types of things. So if you're hearing employees talk about these things, it would be a good time to inquire. We could talk a little bit more about how to inquire as we move along here. But just these would be standard signs of stress that you might hear people talk about, or you might be experiencing yourself. They're warning signs. It's your body saying, hey, pay attention. You want to go ahead, Nick. So with that, I'm gonna challenge you all a bit. How are you taking care of yourself? Much of what we do day to day is cup draining. Hopefully many of you have jobs you like, and those are cup filling activities when you're at work. But stress management requires time for cup filling activities. That's what I call it. Are you filling your cup or is it draining? And it's likely going to be a combination of things. I don't think you're going to be lucky enough to go through life without any cup draining activities, but are you making time for those cup filling activities? And I'd be curious to hear through the chat if anyone has any good suggestions or things they're doing in terms of modeling good self-care, both at work but in your personal life. If anybody's willing to share, I'm going to pause for a second and see if anybody's willing to chat, type anything in there. What I know about people who are good at stress management is they're intentional in their efforts. We get to choose if we're going to make stress management a priority. That's up to us. And that's an important place to start. I'm not seeing any numbers on the Q&A, and I don't want to spend too much time. I've got a few more minutes yet to go, and I want to leave time for questions. Oh, the numbers just jumped up by 1. I don't know if that was related. Gardening, someone said, I work from home so I can take quick breaks throughout the day. Excellent. Excellent idea. Not only are you doing physical activity, it sounds like something you enjoy, and you're outside. I share what I'm doing to deal with stress with my work team. I run during lunch every day. My team knows this is my way to cope. Excellent. You're role modeling. That's a great thing to be doing with your teams. Painting has helped significantly as a mindless activity and a welcome break from the constant thought flood that this past year has brought on. Great idea. I have an easel set up behind me or to my left. I have good intentions. I haven't gotten there yet, but I have done a little bit of drawing these past 10 months. Walk each morning, great idea. Walking and meditating for the first 10 minutes of my day, excellent. Thank you for sharing those. I'm going to keep us moving. You've hit on some of my next slide points, and that's excellent, great transition. Whoops, wrong way. So exercise is the very best, go ahead if you would, Nick. Exercise is the very best antidepressant. Research is very clear on this. It releases the endorphins and it impacts us in a very positive way. The good news is it doesn't have to be Ironman kind of exercise. It can be that 30-minute walking every day. So how do you build that in? And many of you will say, I don't have time, and I understand it. But that's also, that's a barrier. And you might need to take some inventory on where can you find 15 minutes twice a day. Using technology, that's our new connecting point. And I know I experience Zoom fatigue regularly. And I tell my team, and I try to schedule appointments that aren't 3 o'clock in the afternoon or 4 o'clock, because I know I'm not going to be my most productive self there. So you have some control there that you can take. Taking broad breaks and pauses during the day, that's a great idea. If you can build those pauses and those deep breathing into things you're already doing, at Intermountain, we're trying to get folks to take 3 deep breaths every time they sanitize their hands. Just build that into the process of hand sanitation. 3 deep breaths and then moving on. You're already sanitizing your hands 20 times a day. Build this simple activity into your daily routine. If you're doing that as your work site, I would encourage you to try to do that as a practice. Consider a new hobby. My wife and I have become puzzle aficionados over this past 10 months. As I said, I'm trying to get into the art myself. But where's the silver lining here? Can you find something that you've been meaning to do and is now a good time to do it? I always tell people, hang out by the positive water cooler. Water coolers have been nixed with COVID, I understand, but how do you seek out those folks that seem to be managing this well? Practicing gratitude and mindfulness are also great things to consider. Let's go ahead and show that quick video, Nick. This is an excellent little cartoon or animated video on mindfulness, and I won't spend a lot of time recapping it. I just want to give you an overview. We lost the video, the picture.
You may have heard this word mindfulness. It's become something of a buzz phrase of late. I'm going to give you one simple.
Oops.
Let me reset it. It looks like which is this PowerPoint is being a little goofy. Hang on one sec.
Sure. And if it's a problem, let's just keep moving. I understand.
You may have heard this word mindfulness. It's become something of a buzz phrase of late. I'm going to give you one simple, serviceable definition, which is this. Mindfulness is the ability to know what's happening in your head at any given moment without getting carried away by it. Imagine how useful this could be. Just as an example, you're driving down the road and somebody cuts you off in traffic. How do you normally react? I think most of us, we normally react by having a thought, which is, I'm pissed. And then what happens next? You immediately, habitually, reflexively inhabit that thought. You actually become pissed. There's no buffer between the stimulus and your reaction. With just a little bit of mindfulness, in that same situation, you might notice my chest is buzzing, my ears are turning red, I'm having a starburst of self-righteous thoughts, I'm getting angry. but you don't necessarily have to act on it and chase that person down the road, screaming at them with your kids in the back of the car thinking you've gone nuts. Now, you might be thinking, don't I need to get angry sometimes? Aren't I justified? I would say yes, but probably not as much as you think. The proposition here is not that you should be rendered by mindfulness into some lifeless, non-judgmental blob. The proposition is that you should learn how to respond wisely to things that happen to you, rather than just reacting blindly. And that, my friends, is a superpower. How do you get it? The way to get it is through meditation. I believe that meditation and mindfulness are the next big public health revolution. In the 1940s, if you told somebody you were going running, they would have said, who's chasing you? But then what happened next? The scientists swooped in, they showed that physical exercise is really good for you, and now all of us do it, and if we don't, we feel guilty about it. And that's where I think we're headed with mindfulness and meditation. It's going to join the pantheon of no-brainers like brushing your teeth, eating well, and taking the meds your doctor prescribed for you. Let me just close by saying, mindfulness is not going to solve all of your problems. It's not going to render your life a nonstop parade of unicorns and rainbows. Nonetheless, this is a superpower, and one that is accessible by you immediately.
Thanks, Nick. Again, the research is off the charts on mindfulness and meditation. So the good news is I really have struggled with this myself, but I've come to learn I don't have to be perfect at it. And I think that's really helped me. It might only be 30 seconds that I can be mindful and practice some meditation. That's okay. My thoughts may drift away and I might move on, but I tried it, I stopped, and I took some deep breaths, and I engaged in this purposeful activity. So think about it. If you haven't done it in the past, I know one of you said you have, you're doing it regularly, kudos to you. Next slide, Nick, please. We talked about limiting time with news media. Setting a schedule can be important. One of the latest trends I've heard around people who are working from home is they are literally getting in their car at 8 o'clock in the morning, driving around the block, parking their car, walking into their home office, and they are doing the same at 5 o'clock or 4 o'clock whenever they leave, because they're finding that the transition really helps them plug and unplug. Not suggesting that's for everyone, but I thought it was a unique and creative idea. Focus on the things you can control. We've talked about that. Seek out support if needed. Again, I don't know who's all in the audience, but I would imagine that you have an employee assistance. Some of you have an employee assistance program, either with Intermountain or Blomquist Hale, one of the sponsors. If you haven't sought those resources, I would encourage you to do so. Morissa shared a number of other resources that are out there. Please take advantage of those. Finally, we'll wrap up this section with another quick video to get outside. Here's another light video if Nick can pull it up.
Hi, are you feeling tired, irritable, stressed out? Well, you might consider nature.
Nature is a non-harmful medication shown to get you out of your head and into the moment.
Nature's recommended for people of Hi, are you feeling tired, irritable, stressed out? Well, you might consider nature.
Nature is a non-harmful medication shown to get you out of your head and into the moment.
Nature's recommended for people of all ages.
In rare cases, being in nature may cause you to wake up to the mundane absurdity of consumerism and self-centeredness.
Don't be alarmed if nature gives you a sense that you're connected to everything.
Excessive bragging about nature or what you did in nature may be a rare but serious case of tomfoolery.
Nature turned my life around, got me back on track.
If every time you are in nature, you think, gosh, I really should spend more time in nature, then spend more time in nature. Side effects may include contentment, wonder, peace of mind, and smelly feet.
Ask your doctor if nature's right for you.
Nature is inexpensive, easily accessible, and available to you now.
Obviously, I like to bring a little levity into how I deal with stress. That's important to me. I think a sense of humor is. Again, how do you find it? Where do you look for those things that can make you smile and laugh and connect for a while? So real quick, leading under stressful times. Again, nothing rocket science here. Go, get out of your office. And again, right now, that may not be the case. You might need to jump on Zoom more often. Checking in with your employees is important. When you're back in the office, I would encourage you to get out and walk the floors if you aren't. Checking in with people. How are you doing? How are you doing is a good lead-in, but be careful. Many of us will gravitate toward fine even when we're not feeling fine. So if you're sensing that that's not a sincere answer, dig a little deeper. Are you sleeping okay? What's keeping you up at night? When you say fine, what do you mean? Kind of define fine for me from your perspective. Follow it up with a second question that might allow you to dig a little deeper with that employee. Over communication is important. If under times of stress, if people don't have information, they're going to make it up, or they're going to seek it out in sources that may not be accurate. So in particular, I'm thinking about returning to work if you haven't done that. We've just started communicating about that in my office, and there's a lot of angst about it. So I know I need to be giving people regular updates about what the next steps are. Again, think about that in terms of how do I provide information? Even if I don't have information, which I'll share sometimes with my staff, I don't have any updates about returning to work. But at least I'm letting them know that it's top of mind for me, and I'm going to bring it forward when I have it. Look for your champions. Who's doing this well? How do you tap into them to help the other colleagues that aren't doing so well? Encourage creativity. We just had a 7-hour Zoom meeting in December. That was 3 hours of work and 3 hours of party, if you will. And we had some great ideas. We did an on-Zoom scavenger hunt. We played Zoom bingo. We did a Zoom sing-along. So I tapped into the strengths of my team, and we did 3 hours of Zoom. And after 6 hours of Zoom, somebody even mentioned, wow, we've been on this call for 6 hours and we're still smiling. And I thought that was a good sign that we had done something well there. Looking for positives, build on past responses. How have you handled difficult situations in the past, and can you tap into any of those things? If you can limit major changes during this time, and you may not be able to, but if you can, think about it. Can you postpone, this initiative or this decision? And you may not be able to because of COVID. I get it. Be curious, seek out your team. We talked about that. How are you doing? What's keeping you awake? Are you feeling good about work these days? Those types of questions will be important. And then offer support and resources. We already talked about that one. Again, they're out there, look for them. And if there's anything we can do as a community member or your EAP, please let me know. I think that's my last slide, Nick. We got a few minutes for questions, I hope. Not many, sorry.
Matt and Morissa, thank you so much for all of that information. That was just incredible. I think there's a lot to unpack there. And so we want to encourage the viewers again, if you have any questions on any of this, plug them into the Q&A window, and we'll try and run through a couple of them right now. One question that has come in, and this is a common one, but asking if the slide deck will be available to folks afterward. If Matt and Morissa, if you're okay with that, we'll blast it out to the attendees as well, and make sure they have access to that. But for those of you watching, again, keep thinking, any other questions or thoughts you have. One of the things that I've heard is, how do we actually apply this? A lot of business leaders might say, hey, this is great, I love it, but it's kind of overwhelming. What do we actually do to start doing this, and how do we implement it for our business? So maybe if I can start with that general question to either one of you, again, for the business owner that says, this is great, where do I start?
Well, I think first and foremost, I hope you'll post the resources or explore the resources that Morissa, spoke about on her presentation. The emotional relief hotline, if that's not something that's in your workspace, I would certainly encourage you to get that number out and post it wherever it makes sense to do so. I think engaging your employees in perhaps we've created a wellness task force in our work group. And so I think, do you have some champions that could sit with you and generate ideas about how to implement some of these things and get them involved? Could be a good thing. Those are two things that come top of mind for me. I think breaking it into small pieces, it can feel a bit overwhelming, Nick. So maybe you want to, you maybe want to start with just, weekly or every other week check-in, or weekly or every other week, Zoom luncheon, just an effort to bring people together and connect. So I think, asking your staff what would be helpful to them is probably a good approach as any, and then trying to find some champions to help you with that. That's what I have, Morissa. Jump in if.
Yeah, and some other things that I think we have tried to do, and Intermountain's a huge company, 40,000 people. So even within our company, there's lots of sub worlds. So there's many different settings in which people work. Something that I like is that we have a newsletter that was actually started during COVID that goes out. There's a leader version, and then there's sort of an employee version. And there's always tips, particularly for leaders, on how to integrate, as Matt said, sort of simple prompts into their weekly staff meetings or individual one-on-one interactions. Because I think so often what stops leaders, whether that's a manager or even a CEO, from saying something is they're afraid of saying the wrong thing. And the truth is, and I think Matt can speak to this more, expressing that vulnerability and even saying, I'm not sure of what the right thing is, but I want to acknowledge this is a really hard time for me too. And just normalizing and active listening can go so far. So we've tried, it seems like every week, these newsletters feature some sort of little sprinkle of, here's a conversation starter, here's a way that you could kind of engage in an activity with your team, and trying to make it very practical. And so, yeah, just something that we're trying. There's even pocket cards that we have for some of our clinicians who are kind of thinking through, how do you help a team of nurses kind of, find ways of closing out a difficult day and going home feeling more of a sense of renewal. So anyway, just I think keeping it into these small doses is really important, and then sprinkling it often across multiple forms of communication within your organization.
Perfect. Thank you. Another question that comes in, and this one seems very relevant to probably many of us, especially over the past year, saying, I've been having a hard time staying positive in the workplace. COVID has pushed me into a position within my organization that I never thought I would be heading. Any additional tips on how to get myself into a good place so that I can help others in my organization?
Do you want to take that, Matt?
Well, I'm going to start with, who do you know does seem to be managing it quite well? And is that someone you can tap into? If it's a colleague in the chamber, if it's a colleague at work, somebody seems to be able to, whistle as they're walking into work every day through this whole thing. What are they doing? I'm gonna pick their brain, and I'm just gonna put it out there and say, I've been struggling. You don't seem to be having the struggles I have. Are you willing to share anything that you're doing? And they may have some ideas. I think we have to cut ourselves some slack also. We're not gonna, we may not, our tolerance is being impacted, and that's okay. I think finally, I would say, obviously reach out to a professional if you're feeling like you can't get out of this. And again, I don't know who this person was or what resources they have available, but I do know the Emotional Health Relief Hotline is available to them. If they have EAP, that's another great resource. Obviously, if they have insurance and access to counselors, that's another great resource.
Yeah, and I think to that point, not self-isolating, which can be so hard, especially for those of us who are working from home. I think one of the beautiful things to come out of this, if there is such a thing, of this past year, is an acknowledgement that while not all of us have mental health issues, all of us have mental health, and that this is really, understanding, as Matt said, that there are times each of us is not going to be our best self. There are times that, like in my talk, my earbuds die, and it's not the style I'd like to bring to a presentation. I mean, acknowledging our imperfections is a very healthy thing. And I think seeing our leaders do that is one of the best ways that we can create authenticity and resilience among our teams. So I would say, put on your own oxygen mask, of course, get the help and support you need, but also when appropriate, find ways of acknowledging your vulnerability and encouraging others to do the same, because it's not like any of us is, even post-COVID, going to not face challenges and failure. And this can be an opportunity to begin learning how to communicate that.
That's perfect. And that's actually a great segue into one of the major themes of our series here, Utah Community Builders at the Salt Lake Chamber. And you hit the nail on the head, Morissa, just that aspect of we all have mental health. That's why, I often try and give props to groups like Room Here, one of the nonprofits that sprung up in the space that's trying to reframe the conversation around mental fitness, which is why we labeled our campaign Workforce Resilience Through Mental Fitness. Because regardless of whether somebody has a clinical diagnosis, for example, or is feeling, just an outsized chronic level of stress or worry or any of those kinds of things, the term mental fitness encompasses literally all of us. We all know, well, I could be a little bit better in my physical fitness. We recognize that. We could also all be a little bit better in our mental fitness. So I love that you said that it's all encompassing for all of us. And that's kind of the goal with this. Well, one other quick question that came in kind of in terms of the practical application, again, kind of the what's next question. One of our viewers asks, does the Live On program help roll out this information to companies, Zoom trainings, things like that?
It's a great question. So Live On is relatively new, and actually our initial year's focus has been largely on community organizations, particularly underserved groups. So we did a series of grants to tailor the Live On content to especially more disenfranchised groups across the state. That said, we do have an aspiration of really looking to partner with more of the workforce efforts. And I think the Chamber has been so extraordinary in that respect in partnering with the same folks behind Live On at the Department of Human Services in particular to say and I think you even did, as I recall, Nick, a session on Live On a few months ago. So I think I'm glad you asked the question, and I'm going to actually bring that back to our steering committee to say, how can we make sure that all the tools, resources, kind of the package of Live On content is available? Because I know at Intermountain, I would love to why should our HR team be reinventing the wheel? We should just co-brand, make it appeal to our audience and target groups and roll it out. It's not meant to be proprietary. It's meant to really be inclusive and widespread. So I love that question. And I will follow up so that we make sure the Chamber can distribute that as we package more of Live On for a workplace audience.
Great, thank you. And one thing to add to that as well is what we've tried to do at Utah Community Builders with the Chamber website is house some of those resources as well. So for viewers, if you go to slchamber.com/workforce resilience, that's the location that houses all the content in our Workforce Resilience Through Mental Fitness series. And so we have a resources section there that we'll be continuously adding to as far as other resources and tools that businesses can use to actually implement these kinds of things. So, but before we close, I want to mention one last thing and ask both of you to kind of give us the final word. But just building off that concept of the idea of mental fitness rather than just focusing on mental illness, but all of us can improve our mental fitness. One of the things that I think, Morissa, you kind of touched on toward the beginning of your presentation was this effort is not just about preventing suicide or reducing the extent to which mental health issues have a drag on our wellness, our productivity, or our work efficiency or innovation. It's not that kind of focus, but really the goal is to help us all not just to survive, but to thrive, to become better in our personal relationships and our work. And that idea of thriving rather than just surviving through this period is something that I think, as you said, it kind of goes back to, I don't want to just focus on the frustrating aspects of all this, but the uplifting and invigorating that we can really thrive. And so in that spirit of optimism, I want to turn to both of you for the last word on, give us that final dose of optimism and enthusiasm as all the people watching today rush back to their employers and their workspaces to implement these things and change the world.
I love that, Nick. Well, I will say I love that word thrive, and I would say the word flourishing is one that I think of often. And I would just say what gives me the most hope is the ways in which behavioral health treatment, which has been a broken system for too long, is finally experiencing the transformation necessary to actually be effective and navigable. And number two, that each of us is grappling with our own vulnerability, which is at the heart of that innovation and at the heart of the resilience we want to see in our teams. So I find a lot of hope from that on the hard days.
Yeah, and I think the word that comes to me again, Nick, maybe going back to the beginning of my slides, is intentional. I think, you know, people that strive, it's rarely by accident. And again, I know that's not always easy for everyone, depending on where they are in their mental health. But to the extent that I can get up and make a plan and be intentional in the things I'm going to do today, I think that can be incredibly helpful. Related to what Morissa said, I think to the extent that we are seeing a change, and the wheel is turning as it relates to mental health. The stigma is decreasing about seeking help. And I think if we can keep talking about that and normalizing and how important it is for us to take care of our mental health, just like it is our physical health, if not more so, I think that will have a big impact.
Wonderful. Thank you both again for your time and your expertise today, giving us this really in-depth and thorough training, if you will, on these issues and taking some questions. We also want to thank again our sponsors, the George S. and Dolores Dore Eccles Foundation, AT&T, Larry H. Miller Group of Companies, FJ Management, Blomquist Hale, Intermountain Healthcare, and the Utah Department of Human Services. Again, thank you all for participating today. And Morissa and Matt, thanks again. We'll share the PowerPoints you provided with our audience, and I'm sure you'll get more questions of how to move this effort forward as we go.
Thank you.
Very good. Thank you.
Thank you all.